Before you post.
Mm-hmm. Oh, it's not. Yeah, you just did. I could do that.
Well, good luck, Paul.
Something weird's going on right here. Why isn't it showing my text?
I better get out of here before real people start showing up. All I've got to do is put it into it, and then we'll be live on her. Now, do you need a charger for your camera? For your phone? Well, see, now the sun's ringing.
The nice thing is, I'll show you how this works.
Well, they call it topic.
Basically,
I'm gonna give him
the scene is dictated by what I put here. This is static.
Yeah.
So I just created an image for that, and
I think that's really nice.
then when we're ready to go live, I can just move over here and tap lunch and lecture, and it will flip the input to webcam here.
Carol, I'm sorry, I don't know extension. It's cropped down here. Okay. Thanks. And then I see the street over there now.
What's that?
Now I see the street over there once.
Oh, yeah.
Hey, it's Aaron. Are you gonna run out and grab some lunch? Yeah, would you mind? Because I was just gonna eat this, but it's not very great. So, either like a salad or something like that. Something simple or. Where were you gonna go? Yeah. What's right here? Well, I usually get them from Wendy's, but there's not one right by here. Yeah. They have like a strawberry with strawberries and chicken in it. There's only like 3 strawberries. There's only like 3 salads at least. Whatever it comes with is good. Because it comes with the vinegar. There's a half or full, but I want a full. No, I'll have water. That'd be awesome. Thank you. Bye-bye. I guess I could have went to lunch after. I should get my phone shut up. Where did I put my phone?
You think you got enough charge to get through? Yeah. It's kind of cool. Basically, I created 2 scenes. Okay. Whichever one I have active is the one that's streaming out. So this is just a static image that I created for this page to let them know it's coming, not there yet. Then click over to live lecture. They'll get the whole live stream. Yeah, it's coming from the mic.
Possibility they cannot hear if she's not standing here.
So we got to keep her in the front of the laptop as much as possible.
Oh, that'd be good.
Yeah.
Have to figure something out.
That's why when I get the better back, I think we would do a better job of, yes. Yeah. We just yesterday out to the laptop or after the night show as it's been switched with my computer and everything. Then I would take it off the laptop. We just need 2,500 bucks.
What do you need
Yeah, we need that to do the mixing and the recording. We just don't have any high definition to get those back then.
No, but I mean, audio streaming.
Yeah, we could do that. What I don't know is how we're going to get that.
Audio?
Without
Audio comes out.
it comes out of the mixer. But I don't have any way to put it into the laptop.
What? Like that?
Yeah. But if we want the speaker too, we still need that video mixer to feed whatever's coming out of here plus live camera. If you want to have a true switch show.
No, I'm not doing it.
Okay. Gotcha. Yeah, because
This one has limitations.
right, right.
If he's off around it.
Right.
And this combination of
Yeah, we'll have to play around with it and see if there's another option. I mean, in the interim, we could possibly take the output of this mic and just feed it. This one will take it. Yeah, I think I've got a charger back here. But I don't. I've got the extension. I've got the mark meeting.
I'll have to wing it. Well, I'll tell you what.
You can switch using that remote.
How do you switch?
Oh. Yep.
And is there hormones?
There is. Yeah, we're feeding out that slide and projecting it a bit so that mic on the laptop computer. We're going to try to find a better way to
Oh, the
do
mic
it.
on the laptop.
That's going to feed the YouTube.
Do I have to wear this one?
Yeah. You do. That one's Facebook.
Oh, oh. I don't like being against it.
Yep, we should be good.
Let's just start.
Welcome everybody. Thank you so much for coming today. This is a topic for women's health. And this is something that she has a lot of experience with. And I've seen this lecture, the PowerPoint, and it's fabulous. So I'm so excited to hear this information and for Dr. Jen to share it with you. Just at your place, we have the next two upcoming lectures that we're going to be having. One is Food is Medicine, and that is a lecture that is available in person. Also, we're going to stream it online. So if you want more information, go to the website on that. And then we're also happy to host in February Dr. Jennifer Jackson, who is a medical doctor at KU School of Medicine, and she's going to be coming in and talking about dietary effects and how we can protect ourselves against heart disease with diet. So information's at your place, and if you have any other questions, just grab one of us at the end of the lecture. So, thank you, Dr. Jen. Thank you, Ann.
As Ann said, I'm Dr. Jennifer Mead, formerly Kallmeyer, and I am a naturopathic doctor here at the Riordan Clinic. And I have been here now for just about 6 years as of March 1. And as Ann said, I do have a lot of passion for women's health, especially infertility. And one reason why I think I like working with couples who are trying to conceive, who have been diagnosed with infertility, is because a lot of times it is unexplained, and I like a challenge. So I don't like to be told we don't understand or we don't know why, and so I seem to do a pretty good job at the investigation part and figuring that out. So our talk today is the natural approach for infertility. And this is our agenda. I'm going to give you an introduction to what infertility is. Most of all of you probably know the different causes of infertility as of 2016. Different laboratory testing that we might utilize when we see a patient with that concern. General treatment options, we'll just run through that real quick. And then this time, I've done a talk in 2012 on infertility. You could probably find it on YouTube. But this time, I'm going to go a little bit more into methylation and how that affects fertility. And that's kind of maybe an unknown term to some of you. I know I have different levels of knowledge in the room. I'm trying to keep those very simple. I'll do the best I can. But we're going to go into depth about methylation, defects, and how it can affect fertility. And if time permits, I was going to do a throwback to 2012, where I guess the way back Wednesday, it's not Thursday, but I'm going to bring some of the old slides that I talked about 5 years ago and go review those again and then talk to you about how that even then was relating to methylation. So, okay, what is infertility? Infertility is usually diagnosed if a woman, or I guess a couple, has not conceived after 12 months of trying, if they're under the age of 35, and if they're over 35, they deem them infertile if it's been or 6 months or longer. They say 25% of couples, I think it's a little bit more than that, are having problems conceiving. And it's rising. Every year that number rises. And this is a new graph I got supposedly from 2016, the prime causes of infertility. And what you'll see is the majority, 28%, is under unexplained. So no real known cause. Those are the majority of the patients I see. And you also have sperm problems, so that's motility, sperm count, morphology of the sperm. You got ovulatory failure, basically the woman's not ovulating. Tubal damage. Usually tubal damage occurs from a history of pelvic inflammatory disease. Different STDs can cause that. Endometriosis, cervical mucus problems is another cause of infertility. Coital problems, I think that's just basically erectile issues. And then other 5%, I don't know why that's not partly unexplained. I don't know what the other is, but anyhow, the majority of cases are actually deemed unexplained. It's kind of interesting. That's why I like working with these cases. The treatment options at this point, the majority of the treatment options are, of course, surgery if there's abnormalities. And of course, normally if I see a woman, I make sure to go through all these, making sure the fallopian tubes are open, there's no scar tissue. I do think those sort of surgeries are definitely beneficial if that is one of the problems going on. You got ovulation induction drugs like Clomid. Basically, it helps the body make more FSH and LH, so women have better ovulation. Intrauterine insemination, implanting the sperm directly into the uterus, and then you got in vitro, where all that's basically done in a petri dish, I guess. And then you have natural treatments, and that's what I'm going to highlight on today, and more particularly the natural treatments for the underlying cause. And really, the natural treatments can be part of infertility, but also I see a lot of patients who are just wanting to get pregnant, they have a lot of health concerns, and they just want to get healthier to make sure that they don't have complications, and they just want to make sure they're as healthy as they can, and this is implemented for those patients as well. So these are a lot of the causes of infertility that respond well to natural treatments. And actually some of these causes I listed here are part of the but autoimmune diseases can certainly cause more infertility, cervical mucus disorders, egg quality, endometriosis, luteal phase defects. Basically, the second half of the cycle isn't very long, low progesterone issues. And it's not just progesterone. We actually work on trying to get the body to make progesterone. I don't just give progesterone. Male factors, we work on sperm count and quality. Metabolic syndrome, that's a big one that I see a lot of when patients are trying to get pregnant. They have insulin resistance. A lot of these patients are not even overweight. You usually think insulin resistance is overweight. I actually had a 16-year-old I saw recently who had extremely high insulin to normal weight. She was in the early stages of PCOS, and the mom brought her in. And so I always make sure I run fasting insulin levels. PCOS disorders kind of related to metabolic syndrome. That's cysts on the ovaries. Stress. I hate that word. What is stress? But stress does affect fertility, thyroid disorders, and methylation defects. And honestly, a lot of these things, for the most part, a lot of these causes, there's more than one going on at one time. And methylation defects can cause stress problems and thyroid problems, and so they're usually certainly multifactorial when you're looking for the causes. But these are the things that most people have and that natural treatments really respond well to. So the natural approach that we utilize here at the Riordan Clinic, that most naturopathic doctors utilize, functional medicine providers as well, it's very extensive and individualized. So we still always take, look at every person differently. Everyone has their own makeup, their own exposures. And a lot of the natural approach really involves the investigation part. I think that is a big missing part. I mean, you can do all the things that they say to do, but you really need to investigate what you need to do. And it definitely helps with compliance when the patients see, wow, I do have this problem. They stop saying, well, my next door neighbor drinks 80 ounces of caffeine a day, and she had no problem. Why do I need to drop off caffeine? Well, a lot of these labs help give reasons behind it. Success rate, I went back and looked at some of my patients. I was kind of hard to give a percentage. I would say about 75% of the ones that I have seen usually achieve pregnancy within 2 years of trying. And I'm going to give you a case study later at the very end. And also the natural approach, even if someone is going to do IVF and all the other more invasive protocols, it can increase the likelihood of those being successful, because a lot of times people spend $15,000 they are not successful treatments. And there's very minimal side effects. I usually say the side effects are going to be either one, a baby, or two, the other health concerns getting better. And so most of the time people have other concerns. When I put them down and start going through everything, there's not just infertility is not the only issue going on. So how do we do the investigation to get to the causes? A thorough interview and a physical exam. I mean, the interview is one of the most important parts. So I usually spend 90 minutes with a patient. I want to know everything. I am nosy Rosie. My mom used to call me. I want to know physical history, emotional history, abuse. I want to know environmental issues, anything they've been exposed to, social history, family history. I mean, all those things play a big role. We do a lot of laboratory testing, and it may be blood, urine, stool, saliva. I usually decide on that after the interview. So that's part of the investigation. And the laboratory testing, I just listed a bunch of labs that I do like to do if the couples come into me with infertility. These by no means are listed in order of importance. So, but these are all beneficial, and especially if a couple is older or they've been trying, and a lot of these couples are frustrated, I do recommend usually trying to do them all as much as we can at the time so that I can really see what's going on and develop that art to help them. So nutrient testing, that's very important. It not only tells me you have a deficiency, but it can also tell me a lot about the patient's biochemistry, what pathways may not be working, and if they're not working, should we supplement some of the end products of the pathways and whatnot. Hormone testing, blood or salivary. I get this question a lot. I typically do blood during the luteal phase of day 20 to 22. It's been tested more than the other routes of measuring. Salivary hormones, I do sometimes. I've done it a couple of times. I do those monthly salivary tests to see how the estrogen is over the month. Those can be helpful. But normally blood testing for hormones is sufficient. Thyroid testing, I do the full panel, including the reverse T3. Reverse T3, if it's high, which I see a lot with infertility, is a sign of stress, and we work on that. Adrenal testing, another stress test. Assess stress on the body. Insulin resistant testing, I mean, you could read the rest, CBC, CMP, digestive analysis, I do that a lot. I would say 9 out of 10 cases of patients who are having fertility issues are chronically constipated. And that does play a role in the estrogen metabolism, making sure the bowels are moving, and the majority are not. Some don't even know they're constipated. So I ask a lot of details. How often do you go to the bathroom? What does it look like? Sometimes heavy metal testing and other toxicity profiles can be important. I don't always do those right away. And then I bolded the MTHFR gene and methylation testing, and then the homocysteine, histamine, B12, folate as part of methylation testing. How many of you guys have heard of methylation? I know it's kind of out there in the media. Maybe Mercola's talking about it, or Oz, or one of them. We're going to hopefully learn some of that today. If you can take one thing home today, I think that's successful. And then other gene testing. We can do COMT, CBS, and I'm going to go through all that. Okay, so methylation? What is methylation? I'm going to do my best to answer all these questions. What is the MTHFR gene? What are other methylation genes I should look for if I'm having fertility issues? How does this affect my fertility? What are signs that I might have a methylation problem? And how do we, quote unquote, treat? And I put treat in quotes because I don't like to use that word for methylation problems. We don't treat genetics because it's very complicated. There's no one way to treat it. You have to look at the big picture. So I didn't know what other word to put, so I put treat in quotes. So what is methylation? So it's actually a biochemical process that's going on in every cell of your body, and it utilizes B12 and folate. And basically what it's doing is just moving carbon atoms around. It's how our body turns things on and off. It's how you express genes. If you're methylating well, you're not over or under, then you're going to turn genes on and off like you should. If the methylation is not working well, you may have some problems. Okay? Kind of a detox pathway. Things that happen with methylation, you synthesize your neurotransmitters. So what is that? Dopamine, everyone's heard of serotonin, right? How many people have taken L-tryptophan or 5-HTP to make serotonin? You may have read about that. You can take it, but if you're not methylating well, you probably will not convert it to serotonin properly. So methylation also helps process out a lot of your heavy metals and your hormones. So even our own stuff, our own chemicals that we make, our bodies have to process out. So it's not just environmental stuff, it's even our own hormones. We have to detox them out. And if they're not working well, there can be ramifications. And I'm going to go through some of that. And it regulates hormone and immune system. Methylation does. Okay, so I am not going to go into detail with this. I'm not. I'll let Dr. Ron do that at a later date for you guys. But I mean, this is actually a simplified version of methylation pathway and what's going on in your cell. I'm just putting this up here to make a point that it's pretty complicated. And I know you cannot see that. or probably online. But I'm sure you can Google methylation pathway and get this on your computer without any problem. But there's a bunch of biochemistry going on here. And basically, methylation is all about, this is homocysteine. It's all about recycling homocysteine. And when you're recycling homocysteine, you're making something called SAMe. It's a major methylator in helping your body detox hormones out. And you probably all may have heard of high homocysteine. Cardiologists may know that for heart disease. That's why a lot of the MTHFR labs I'm seeing doctors are usually cardiologists or on the panels. But anyway, MTHFR is right here. And I'm going to go back to this in just a minute. Okay. What are signs of possible methylation defects? So when I'm doing a history of a patient, and I go through the family history, if you or any of your family members have had a history of any of these issues, and there's a few more, but these are just the majority of them, cardiovascular disease, especially if they're under the age of 65. So if your grandfather had a heart attack at 50, probably there's a methylation issue. Neural tube defects, spina bifida, anencephaly, cleft palates and lips, tongue ties can be related. Recurrent miscarriages, if your sister or your aunt has a lot of miscarriage problems. Mental illness, depression, anxiety, bipolar, schizophrenia, all related. Chemical sensitivity, fibromyalgia, autism, all related to methylation problems. So, if any of that runs in your family, probably worth at least checking some of your markers. Why should I be concerned? But when you're trying to get, if you're having some fertility issues and you have a methylation problem or a gene defect, sometimes even doing all the lifestyle things, proper diet, exercise, removing caffeine, all the things that you're told to do, sometimes still is not enough, especially in our toxic world out there. There's a lot of things we can't control, and sometimes supplementation is warranted and actually absolutely needed in certain patients. So it's really good to see how susceptible are you. So gene testing is actually more susceptibility, but it should be a concern, and because it can decrease your fertility, and can cause possibly problems during the pregnancy. Okay, hold on a second. And then I just put, and we're going to talk about the MTHFR gene again. I know I mentioned it several times, but that's the main gene that's been extensively studied. So we're going to go over that. So how does it affect fertility? And this is just in general, I'm not going to go over every detail of this, but if you're not methylating well, you're going to have more problems possibly with implantation because you're going to be at risk for more clotting. So especially if you have a lot of blood clot, or if women have blood clots in their periods, or they have heavy cramping, I mean, that's a sign of estrogen dominance. Probably is due to a methylation problem. So clotting is a big problem. And I'm not saying you're going to get a DVT if you have a methylation problem, but that could be why you're not getting pregnant. High homocysteine levels can actually cause poor oocytes, so the cells in the ovaries don't mature very well. And if you're not detoxing your estrogens properly, it can actually cause basically not to ovulate. Instead of developing a follicle, they can all basically degenerate and you might not even ovulate if you have too many of the bad estrogens in your system. So it does help with ovulation. Methylation working well can help you ovulate better and produce better embryos. So it's very important for that. Methylation problems, like I just mentioned a second ago, can cause what I call estrogen dominance. I know that's a term used a lot, but basically estrogen dominance occurs usually, you can run estrogen levels and they might not be high. You have to look at the metabolites in the body, and I'm going to go over that in just a minute, but the body can make bad and good estrogen metabolites, and if you're not methylating well, you're going to make more of the bad metabolites, and the bad metabolites can cause a lot of problems. And I'm going to give you some real life examples to help you understand that in just a minute. And it can cause, like I said, anovulation. So if you have too much of the bad metabolites, you might not even ovulate. I said might. So what is this MTHFR gene that I'm talking about? Basically, it codes for the methylene tetrahydrofolate reductase enzyme. That's why we call it MTHFR. And what that gene does is it activates folic acid. So it adds a methyl group to folic acid. And then the active folic acid at 5 MTHF. Here, you cannot see this, but trust me when I tell you, that's MTHFR. This is folates and folic acid. It goes through all this stuff, and then it makes this active folate. And then with active B12 methylcobalamin, you recycle homocysteine. And there's methionine. And then over here, you'll make SAMe, and then SAMe comes down here and helps your body break down estrogen. So again, we're going to keep this simple. But if you're having gene defects and that's working slow, you're not going to recycle homocysteine very well. You're not going to make SAMe very well. And then you're not going to process your estrogens well. Now I'm trying to keep it simple, but this is pretty complicated and cause all sorts of problems. But that's why it's very, very important to have adequate active folate and active B12. And I keep saying active because in a little bit I'm going to tell you why you need to stay away from the inactive, the synthetic form of folic acid that's in basically all our food. So, make sure I went through all this. Again, I just typed this out here. The active folate helps you make SAMe, and then that helps you process your estrogens out, and COMT helps you process your estrogens out, and I will talk about that too. Just a second. And the two major genes that we look for are going to be these C677T and the A129AC. The C677T, if you're homozygous for that one, meaning having two mutations, that's the one that causes most of the problems. The ones where you really have to supplement and be cautious. Okay, let's get out of here. So it is estimated that 35% of the population, I would probably say more than that, but 35% have some sort of MTHFR mutation. I'd probably say more than that has a methylation issue. Maybe not a genetic problem, but they aren't methylating well due to our environment. It is carried through families, so that's very important to know. That's why I say if you have a family history of all of those issues that I talked on the other slide, that you might have a methylation problem. And again, it's not the only enzyme implicated in methylation. So when someone comes to me and says, I want to treat my MTHFR with tons of folate, and there's an art to this, and you want to definitely be careful. You want to maybe check for at least COMT issues and make sure that's working well and kind of see what's going on and maybe check all the markers and see is it really a problem for you at that time. MTHFR also, again, recycles homocysteine, so it helps the clotting issue and a lot of other problems. It helps your body make more glutathione. That's a major antioxidant in the body that your body uses to fight stress, and it produces that SAMe. I know I'm repeating myself, but hopefully that'll sink in. And the SAMe is a major methylator for a COMT enzyme to break down your estrogens. That brings me to COMT. So, again, if anyone has any questions during this time, please feel free to raise your hand, and if you want me to clarify some comments that I've made. So COMT is another enzyme that fuels a biochemical process in your body, and it actually plays a huge role in your body getting estrogen out. Like I said, so you make estrogen, your body uses it, and then it has to process it out. I'm going to skip something real quick, but I'm going to go to this. There's a phase 1 and a phase 2 for breaking down estrogens. And phase 1, basically, now you're taking something that's fat soluble and you're trying to make it water soluble so you can get it out of your system. That's what these phases are doing. And phase 1, sometimes phase 1, the intermediate metabolite, which if some of these enzymes are stimulated, like these two up here, and stimulated, you're going to make these metabolites called 4-hydroxyestrogen and 16-alpha-hydroxyestrogen. Those are very carcinogenic to our system. It's an intermediate metabolite. So then that goes through phase 2, hopefully, if phase 2 is working well, and it comes out of your system. If it's not, it can recycle in the system, okay? Now, things that upregulate these two phase enzymes that cause these carcinogenic metabolites are things like this. That's listed here. Benzene, phthalates, estroplastics. That's why they say don't microwave in plastic. Don't eat American cheese. That's in plastic. And xenoestrogens, that means environmental estrogen, so that's your plastics and your pesticides and other environmental estrogen-like chemicals. Cadmium, PAA, that's the aromatic hydrocarbons. That's from like charbroiling foods, blackening things, stuff like that. That's where you get those. They accelerate these enzymes and it causes these bad metabolites. That's in phase 1. And then the job of COMT, going back, is to methylate them and to inactivate them into a non-carcinogenic metabolite called methyloxyestrogen. Anybody gets rid of it. But if the COMT isn't working well, you're going to have a buildup of a lot of these bad metabolites in your system. And that is what can stimulate and cause more estrogen dominance problems like endometriosis, fibrocystic breast, heavy periods and cramping. It's related to ovarian cancer and breast cancer. And so you need to look at COMT too. If COMT is slow, you're going to have a problem. But COMT also relies on methylation. So you can have a perfectly fine COMT enzyme, and if you're not methylating, all those bad estrogen metabolites can build up in your system, cause problems. So you want to make sure both of these pathways are working really well. COMT, this estrogen dominance, and when COMT isn't working well, that also can lead to that anovulation, and that's usually one of the causes of early menopause. So someone goes into menopause at 38, 40, there's usually some sort of issue going on there. Okay, I'm going to give you an example. I think this is a pretty good example. COMT, caffeine. Caffeine stimulates your adrenals. Makes a lot of catecholamines, right? It makes you energetic for the most part. I genetically have a very fast COMT. Okay, I did all my genetic testing. I can go to sleep on drinking caffeine, not be a problem. Doesn't affect my sleep, doesn't cause any problems in me. But some people cannot drink a cup of coffee after 9 a.m. Otherwise they will never sleep, or they're jittery, or they're... So that's telling me that their body is not breaking down catecholamines very well, right? Okay, that those catecholamines, the adrenaline, stays in their system longer. They drink a cup of coffee at 9 and they're still awake at midnight. Those people have very slow COMTs probably. And if COMT is slow and you're loading it with caffeine, then you're putting so much load on it, it's going to have a harder time breaking down the estrogens. Okay? It's going to slow your estrogen process even more. So then what do you get? Bad estrogen metabolites. Then what do you get? Fibrocystic breast. That's one of the reasons why a doctor will tell you you have painful breast or cyst in your breast, stop the caffeine, and a lot of times it goes away in a big portion of the population, especially the younger people that haven't had as much stress on their system. But that's a little bit about why. So if you're sensitive to caffeine and you get sore breath when you drink coffee, then probably have a COMT issue. But that's kind of how that's related. I have a real life, more applicable example for you. Okay. So, and then again, I talked about those phase 1 enzymes already. Probably had this a little out of order. But there's other enzymes you might want to look at. CBS, glutathione transferase. Those are important as well. And I just put this in here. Did you know that the average woman exposes herself to 168 chemicals per day? And that's just in body care products. Makeup, lotion. I mean, have you read the label of what's in Bath and Body Works products? So a lot of those chemicals are estrogen-based chemicals. They do affect a lot of these pathways. So I usually tell a patient, less is more. You know, don't let marketing get you in. Can't eat it, probably don't put it on your skin, maybe. So I try to keep it simple with skincare products. And if they're having skin issues, I try to work from the inside out with that rather than just slathering skincare all over the body. Especially mineral, anything with mineral oil, anything with petroleum will certainly cause some problems. So, okay. So I guess kind of a good analogy is the genetic factors. Like if you look at all these genes, you're just looking at genetic susceptibility. You don't know if it's causing a problem or not. So basically that kind of loads the gun. And then all the environmental stuff and the diet and stuff pulls the trigger. So you got to look at all of these things when you're trying to work with your fertility and get your methylation working well. And this goes for basically all health concerns. So how do we test for methylation defects? you can do a full extensive 1 through 23andMe. That I actually did one through there, and you can upload it to other websites to help you interpret it. There's some that'll do 200 different enzymes. I do think there are ethical implications in that. A lot of doctors talk about that. I do agree with it. If you're going to use the information with as a learning tool and be very productive with it, I think it can be very great. If you're one that is going to cause more stress and anxiety and it's going to lead you to be more scared, I probably would not do a 23andMe and upload it to some of these sites because it goes through risk of certain cancers and Alzheimer's, and a lot of people don't want to know a lot of that stuff. And again, it's a susceptibility screening, not a absolute. So for what we do here, what I usually recommend at the beginning is just to check for a couple of those enzymes like the MTHFR and the COMT, and that's basically what we do here at the Riordan Clinic, and then check for some of the markers like the homocysteine and the B12 and the folate, and just try to put the picture together, kind of use it as some information to see if it really is causing some issues or not. Okay. So after we do the testing and I see a woman and say we're like, your methylation is out of whack, we need to work on this, how do we treat it? Again, I'd also look at COMT normally and look at the gram picture. And the one thing you want to do is you want to work with the enzyme. You want to work with the biochemistry. So you want to remove the things that are bothering it, avoid, and you want to make sure we're optimizing the intake and the absorption of all the B vitamins. That's the one of the most important treatments for methylation. But you got to make sure that you're absorbing them, and there's a lot of other things that can interact. You want to look at kind of all that stuff, and you want to always make sure you're taking the active form of these nutrients because some of the synthetic ones will actually make it worse. For instance, folic acid will more than likely make the methylation worse and cause a lot of problems. So, and then also to help facilitate the pathways, we use the B vitamins, but sometimes we'll also want to use the end products of these reactions. So, through methylation, you make SAMe, you make glutathione, you make coenzyme Q10 as well. And if you're not methylating, and depending on where the patient is, I'll also supplement with some of those end products in the beginning because that can be very helpful in healing the body. Okay, acetyl L-carnitine and choline are also made for methylation. So, how do you support the MTHFR gene and defects? More specific, avoiding all folic acid supplements and the fortified foods. That's the first thing I tell people to do. Do not take anything that has folic acid. And most people say, well, all the prenatals have folic acid. You want to make sure it's L-methylfolate. I have suspicions, and I've read some research that they think that one of the contributing factors to a lot of learning disabilities and autism is all of that excessive folic acid in people who have this defect. So methylfolate, that's what you want. And usually it'll say L-methylfolate or 5-MTHF or metafol, and all you gotta do is look at the label. It'll say that on it right next to it. And then folic acid blocking drugs or some of the drugs that deplete folate, birth control pills, or one of them, methotrexate. I was always taught in school, this is way back, not like that long ago, but 2004 even, that if a woman's on birth control, you always put them on 1 to 5 milligrams of methylfolate. That was kind of a given. That's what we were taught. I didn't quite understand that then. Now I get it a little bit more. And then mainly they told us that because a lot of people with the birth control pill over time will start having cervical dysplasia. And if you take the folate, it'll prevent it. And so I actually had a little case study with my own sister who they were wanting to laser her cervix because of a bad biopsy, and she was scared to death and didn't want to do it. I told her to get off the pill, let's put you on methylfolate, and we did a few things, and she called me yesterday, actually, and her pap smear was fine. She had a normal one the year before, and she was like freaked out, and so I said, calm down. She was worried. She read up, if you laser the cervix, you could have incompetent cervix. Might not be able to, might, doesn't mean not, but she's worried about having miscarriages, and she just didn't want to do it. Methotrexate is another drug. I think I mentioned that. Also, antacids, chronic use of them, Tums. Don't take Tums for calcium. It's not the best form of calcium supplementation, but if you're having reflux and you're having stomach problems and you want to figure out what's going on there, because that blocks absorption of B12 and can cause methylation problems. Gluten intolerance, especially from wheat, that can cause some problems. Reducing dairy is important if you have methylation problems. Caffeine, I already talked about that. Okay, get off the caffeine if there's a methylation issue. Increasing dark green leafy vegetables, you want to make sure your folate intake comes from the food, as there's some importance. That is a natural source of folate. Okay, and minimizing toxins. Okay, especially in our working home, we're around toxins everywhere. Okay, everywhere. Aerosol sprays, cleaning supplies, wood products that's in our homes, and all that can cause problems. Not to scare you. You don't want to become worried about everything, but you want to do what you can control. So supplementation with methylation problems, I didn't really go too much into detail, but I did want to make a point that there is somewhat of an art to this. You don't want to just start taking a ton of methylfolate because you can have what's called methyl trapping or high doses of methylcobalamin right away. I haven't seen it too much, but I did have one patient have a major reaction, threw her into mania by taking tons of methylcobalamin all of a sudden. So you want to be careful that you gradually wean up. And I always say work with someone with a naturopath or a functional medicine doctor, or someone who's familiar with working with these pathways that can help you do it so you're not all by yourself. And you always want to usually start with B12, and then gradually wean up and then start the methylfolate if you're having major problems methylating. Especially if there's an element of bipolar and mental issues, you really want to be cautious with starting methylation treatment. And there are other supplements I always use, B6, vitamin D, fatty acids, of course, need to be there, and active B6 is what I mean. You want to make sure, B6 is the active form, P5D. And I usually start diet, active B6, removing stuff, a little bit of B12, and then gradually work up on the nutrients over time. So, okay, a summary of actions to address methylation problems to help fertility is definitely get the lab testing. I think it's really, really important, especially if you're frustrated and you want to start. Most of the patients I see are frustrated, they're ready to start a family, and it's just best to get it all done all at once if you can. Make sure your prenatal has the active folate in it. Throw the other one away. Do not take it until it's gone. Throw it away. Read your labels. Make sure you're not eating fortified grains. Even stuff that's 100% whole wheat, sometimes they add it in there. And honestly, it is not hard. You can go to Walmart even and shop there and get stuff without folic acid added to it. Avoid. Remove toxins as best you can. All right, you can't remove everything, but we do have control over a lot of things. And so look around your environment and see what you can remove. Seek the care of a naturopathic doctor or a physician that is familiar with methylation. A lot of the functional medicine doctors are very familiar with this, and always have someone on your team if possible to help you through it. And remember that this is treatable. It's one of those actionable steps. You play a big role in whether or not you're having methylation problems or not, and how your genes are being expressed and not. We have more control than you think. So so if you get a test back and it says you have 2 mutated genes, don't freak out. There's a lot of things that we can do, but it's good to know that that is running in your genes. So most of the time it helps with compliance. It helps me when I know I have an issue. Okay, so I'm going to go through a real quick case study with a patient of mine that I saw her the first year I started here. October 2011, I saw this very nice, sweet young lady. She was 39 years old at the time, 5'9", 145 pounds, so she was not overweight. She came in, mainly at that time, she was depressed, she was tired, she had a lot of hormonal problems and chronic constipation. And she just wanted help with that. She was also a vegetarian, so probably her B12 intake was on the low side. And she had a significant history of bulimia off and on her adult life. She was still having some problems with it, and she has a huge family history of major addiction, substance abuse usually. So addiction, methylation, usually there's a methylation problem if there is a history of addiction in the family. So we did some lab testing on her. She had food allergies, lots of food allergies, especially to the grains. She had extremely low DHEA, adrenal stress, low fatty acids, very low coenzyme Q10. I think it was very lowest I had ever seen, and low magnesium. So we started her on some fish oils, some ubiquinol, which is coenzyme Q10, magnesium, zinc, probiotics. And then I saw her 2 months later. Her bowels were moving daily. Her energy was 50% improved. She was actually doing really well. She hadn't had any bulimia episodes at that point. And then I didn't see her for a while. And then 2 years later, she came in on September 14. She was now 42. Or maybe she was 41. I think I got that wrong. But anyway, she came in, and now she had met the man of her dreams, and she wanted to try to have a baby. She was 42 years old. She had already done IUI and 4 failed IVF attempts. She had tried exercising less. She cut out alcohol and caffeine. She did the gluten-free thing. She had been doing all these things. Her constipation was back, she said. So at that visit, I started her on the prenatal with methylfolate and the methyl B12, fish oil again. I put her on estrogen. Estrogen is it has indole-3 carbonyl and DIM. It basically helps the body process out those bad metabolites. I went ahead and started her on that because I knew her history and she had signs of estrogen dominance. And we did a mega panel and a reverse T3 on her. Also at that time, just to note, she was still off and on with the bulimia that come back. So I really sat down with her and counseled her on stress. And we went and talked a lot about, she's very much sweet girl, not type A. She wasn't like type A, everything had to be her way, but very much a people pleaser. So I talked to her a lot about how, I really think you need to learn more about boundaries. And so I gave her some information, some books to read. I said, you're not aggressively controlling, but this sort of personality is very controlling. It really stresses the adrenals out. And, she's trying to please everyone. And I told her a story. I said, there's this, I was told one time by somebody who said, Jenny, how dare you think that you have that much control over people? And that really hit close to home. And, it kind of made me think, wow, maybe this is not the best, people pleasing. I'm doing the best thing. Maybe that's not the best way to lead my life because it is very controlling. So we did a lot of counseling on that. And actually, she read some books. She really kind of started to see her ways because she hadn't had a lot of counseling. So I really wanted to zone in on some of that with her. And she really started working on putting boundaries up and not trying to please everyone around her. And I think that really did help. But her labs came back a very, very high reverse T3, which is a sign of stress. And the body's trying to slow the metabolism down. Her other thyroid levels were normal. She had suboptimal B12, low D. Coenzyme Q10 was low again, but it was a little bit higher, but still low. Low essential fatty acids. And her DHEA was still low. She had high triglycerides. I think she was still having bulimia, and I think that was part of it. And she had a mild elevation homocysteine at 9. So this was in October or November of 2014. And then we just did dietary changes. I told her to increase her dietary fats because she was still in this no fat, body image issue, decreasing sugar. We eliminated soy. She was eating tons of soy products because she was a vegetarian. And I switched her to the unsweetened nut milks. Put her on a prenatal with the methyl B12 and folate, probiotic. You can read all this stuff. But I did begin her on a little bit of Nature-Throid because of that reverse T3. I personally normally don't do that in the beginning. I usually like to work on the adrenals and stress, and we kind of started doing that, but she was wanting to get pregnant, and so I was like, well, let's just start a small amount of Nature-Throid, which is basically a natural thyroid hormone, half a grain, and let's see if, because I've seen that really help fertility. So I said, well, we start that, and we started some DHEA. She was doing really well. 9 months later, we ran the thyroid, much improved. Reverse T3 was down. She was feeling so much better. She hadn't had one bulimic episode in all of that time. And before that, she might have gone a month without a bulimic episode. And I'm talking real bulimia, major bulimia. And her coenzyme Q10 levels were better. Homocysteine was down, but still no baby 9 months later. A year later, right at November 15, she conceived. And she gave birth in July. And I think to a baby girl, and I've not really seen her since July of 16. So it's been about 6 months, 7 months. And she did really well. Even after 4 failed IVF attempts and an IUI at the age of 43, I think she was, or 40, she just turned 44. And she had a healthy baby girl. So that was my case. That's one case study. So any questions so far about any of this? You know, there's a whole lot of information. Yes. Uh-huh. Pyrroles. So the question is, how does pyrroles work with methylation? So I'm not going to go into great detail, but elevated pyrroles in the urine is a sign that the person is not breaking down hemoglobin very well. Okay, it's a detox pathway, and that is related to methylation. And we know that giving active B6 and zinc helps that pathway, which in turn helps methylation. And I'll tell you, the patients I've seen that have high pyrroles, they normally always, shouldn't use the word always, but 9 out of 10 times have anxiety or bipolar, or they have that addictive personality. Go-getters. I mean, they're addicted to work, they're addicted to something. But if you get the active B6 and the zinc, those pyrroles come down, their symptoms do regress, and they start methylating better, they start feeling a lot better. So it is related to the methylation pathway. So it's a marker. And not every person with a methylation problem has high pyrroles, but it is a marker of a problem. And it's one I really like to test because if it's high and you treat it, symptoms do regress. So that's kind of fun to see. Any other questions so far? Yes.
What about dosing
Maintenance methylfolate. You know, that's a good question. The question is, how about dosing methylfolate after pregnancy? If you have a methylation problem, I think, you know, usually it really, my answer to a lot of questions is it always depends. But, you know, depends on how bad the mutation is. If you're homozygous for MTHFR, you're probably going to need a small dose of methylfolate long term. So like 500 micrograms to a milligram, maybe more if homozygous. The only time I usually go over 1 or 2 is if you are homozygous for MTHFR. Usually those people need maybe 5, even up to 10 milligrams of methylfolate. But I think it all depends on the patient and everything else going on. So, but if you get the diet really well and you're not taking a lot of inactive folic acid and you're eating well, and you might get by with a lot less if needing any at all. But you know, if you have a methylation problem, stay on top of your markers. You know, watch your homocysteine level. You know, get acquainted with your body and your markers and, you know, all that stuff. So. Yeah, ideal level is probably between 5 and 7. You know, you don't want it too low because that could be a sign of over-methylating. You know, it can get very complicated. But you want to look at the whole picture, the symptoms, the lab values, and decide what that patient is needing. Yeah, so it really all depends. That's why I said it's so individualized. Yes, ma'am? Yeah, chronic miscarriages is another cause of methylation problems. Can be a cause of chronic miscarriages. Absolutely. Yep. And again, this is just the methylation part of the whole infertility picture. You're welcome. Thank you for coming. There's so many other things that you're looking at all at the same time. I mean, there is certainly an art to this. It's a science, but there's an art. Could be, yeah, absolutely. I mean, our environment is ever changing. Things are, you know, it's not like this is fixed. You know, I mean, it's changing. But you could have healthy pregnancies. I mean, you could have healthy pregnancies when you're 20 and 30, and then try to have a kid at 39, and methylation could be causing a problem because over time our body gets taxed. Stress. I mean, there's stress too. I mean, you got to look at everything. Absolutely. Any other questions for now? I don't have too much time left. I don't know if I should even go through to my throwback to 2012. But if you guys have the PowerPoint, you can certainly go through this. But basically, I'm just going to run through this really quick. In 2012, I did a similar talk. You can watch it on YouTube if you want. But basically, you'll see everything I talked about there is related to methylation. And a lot of, when they tell you to avoid alcohol, avoid caffeine, avoid the environmental estrogens, this is all stuff I went over in 2012. And you want to avoid those things because you don't want all those bad estrogen metabolites to be made and then to bog down the COMT even more, kind of like I mentioned. You don't want to smoke. Cadmium causes problems, as well as then you have to use up your glutathione to help with damage from the smoking can cause. Now, some people smoked all through pregnancy and had no problem. Maybe their genes, they weren't as susceptible. Who knows? Sleep. No excuses. Priority. So many people make so many excuses not sleeping, or they make themselves stay up because they got to do the laundry or this or that and the other. I tell them, make it a priority. There is a way. Figure it out. But sleep is high importance. If you're not sleeping, a lot of your health is going to be up in array. So, and again, in 2012, I talked about the hormone balancing diet, and what you'll see, plenty of fruits and vegetables, lots of color. There's some interesting studies on lycopene, which is the red color in vegetables and fruits. Tomatoes, you probably see it on the ketchup bottle. And it is implicated that higher lycopene helps the ovaries and ovarian cancer. And there's a lot of research that shows if you are insulin resistant or you have diabetes, but you have high lycopene, it protects the ovaries from cysts. So there is some sort of protection there. I don't know all the details. All I know is nature is very powerful and intelligent, and I would just trust it and go with it. So get the colors in. Eat complex grains. Don't eat the fortified stuff. I mentioned that 5 years ago. Stay away from folic acid and iron. Iron, you don't want extra iron in your grains. Stay away from it. Okay. Buy organic when possible. And especially if you're in Kansas, it's so readily available and it's not that expensive compared to the conventional stuff. Eat phytoestrogens. So I always say 1 serving of a good phytoestrogen a day, chickpea, soy, is actually very good. And that gets into controversy about soy, and stay away from all the fake soy, all the processed soy. 1 phytoestrogen a day is actually a good thing because it helps the body get rid of all the environmental estrogens, basically, in a nutshell. Make sure you get a lot of fat. That's important. I can't tell you how many people I see that do not eat plant fats. It's all animal fats. You want to get plant fats in fish and stuff like that. Reduce intake of saturated fat. Drink enough water. Take a lot of fiber. Not Metamucil, probably. Avoid all the additives and the preservatives in food. I always go over that with patients. There's 12 that I say to avoid with like it's the plague. Always avoid those. Read your labels. Know what's in your food. Reduce caffeine and alcohol. Avoid sugar, obviously. And so these are the supplements I talked about. There's the L-methylfolate, top on the list. Zinc, selenium, all of these things, bioflavonoids, all the colors, ubiquinol. That's part of that methylation. Methylation makes coenzyme Q10. L-pseudocarnitine sometimes, especially if there's a motility issue with sperm motility. And supplements to avoid, again, avoid all the folic acid. Have I said that enough? And this is one I usually use. I like multi-nutrients by Vital Nutrients, the prenatal. It's a really good one. It's a good multivitamin and mineral. It's got everything in it you need. Folate, and I go through that. We don't have too much time. I'm just going to run through this. Zinc is very important. I talk about supplemental dose of zinc in the right form and what zinc can do. Selenium as well. Essential fatty acids. Most Americans don't get any in their diet. I mean, it's every blue moon I see someone who has really good levels just through food. I just see it. Some people have to get it in. It's fine, really. Vitamin E, vitamin C, of course. Vitamin C capital of the world. Vitamin C is important. Yeah, and let me just reiterate. A lot of this, I do see women, but there's a lot of the problems are the male and the sperm quality. So, and the woman that I did see actually had her husband on this diet and zinc and all sorts of stuff as well. Phenylcarnitine, that's important for the sperm. Antioxidants, of course. Get the colors in. Lots of colors. Colors of the rainbow. DEM, I talked about that. I put her on Estrogen. It helps the metabolites of the estrogens. It can be helpful in certain cases. I had one case that actually caused problems, and her problem was actually low estrogen. And so there are some times where you always take every case separately. She wasn't ovulating. Her estrogen was very low, which you don't see a lot, but Vitex, I love Vitex. My favorite herb. Works great 9 out of 10 times, especially for amenorrhea. Helps with fertility, but for amenorrhea, especially post-eating disorder or, due to athletic issues, and it takes about 3 months, and you got to take it like it's a birth control pill, same time of day, every day. And it really works at regulating the cycle. I like tincture form, not as, I don't have as high compliancy there. We're using the tinctures. People like capsules. So I always tell patients though, herbs, I'm extremely picky. You want a good company with herbs. Okay. You want to get a good company. I like Wise Women Herbals and Gaia, Pure and Caps, Thorn. There's some good companies out there, but do not go to Walgreens and get Vitex. It's probably old herb and not active. Black cohosh can be very helpful, especially when there's a low estrogen in the very beginning of the cycle. I sometimes use black cohosh and Vitex. It's also good perimenopausal for hot flashes and stuff. Rhodiola, ashwagandha, amazing herbals for the adrenals. They're calming herbs. I love ashwagandha. Helps the thyroid too. I tell women stay away from the adrenal herbs that are stimulatory. Do not take ginseng and things like that because it'll help stimulate. It'll give you energy, but it'll just squeeze whatever's left out of the adrenal. I like the more calming. Even though it is an adaptogen, ginseng, it does stimulate the body. I don't like that one. Sometimes I do. Other herbs that are beneficial. Other natural treatments, I do recommend acupuncture. I think it can be very helpful, especially if there is an element of stress or abuse. I see a lot of history of sexual abuse and infertility. Acupuncture can be very helpful. Biofeedback, deep breathing. I can't tell you how many people do not know how to breathe. Every patient I see, I have to tell them how to breathe. They breathe raising their chest. I tell them, keep your chest down, and when you breathe in through your nose, belly goes out, diaphragm goes down. I've gotten a person off Xanax, several people off Xanax, just teach them how to breathe right. And they look at me like, oh, really? This is going to help? So, very helpful. Let's see. Of course, manual treatments, chiropractic care, all that can be very, very helpful. Avoidance. Main take home. There's not one cause of infertility, usually. Even if it's endometriosis, we want to find out why you have endometriosis. It's always multifactorial. You want to look at the whole picture. And you won't know unless you investigate or have someone help you. So do the investigation. And we're here to help you achieve your miracle. So, it's, a lot of what we do is out of pocket, but it's a really good investment. And, really, even all the labs we do in 12 months of doctor visits and stuff is less than one IVF attempt. So, do make it a priority to take care of yourself and do the investigation if there's some health concerns, especially if there's infertility issues. The end. 4 minutes over. Questions? If you guys have questions after, I'll stay over and I'm here to talk. Hopefully you guys took at least one take home from this talk. It's very complicated getting into methylation, and it can be very hard to teach. So hopefully one take home, I would call that a success if you got one. So thank you guys for coming.
Will this be on YouTube?
Yeah, I think so, and I think it was live on Facebook. Which, is it off now? Okay. Which I didn't sign a waiver for that one.
It was live on Facebook.
It was live on YouTube. I don't even know how to do it. I don't like doing video.
We also posted electron methylation, so if you want more information just about that, that's on the YouTube channel.
That goes a lot into more detail. Sorry. Are we on? Are we still on? Oh, wow.